you are. I know you've been here in the past, and I sure hope you keep coming back in the future. This ties into our topic for today, your past and your future. You probably already know that I'm Menopause Taylor, the menopause guru, whose mission it is to make it possible for all women to get the menopause education they deserve. And one of the things that most menopausal women concern themselves with most is fear of breast cancer. So I'm in the process of giving you a huge unit on breast cancer that will address absolutely everything. We're actually toward the end of the unit. This is video number 408, and believe it or not, it's the 53rd video in the unit, and it is close to the end of the unit. I started this by teaching you about the anatomy of your breasts and your breast hormones. And then I went on to benign breast diseases. And then we covered the risk factors for breast cancer. After that, we dissected the question of whether or not HRT causes breast cancer. And then you learned about the pathology, the symptoms, the screening, the diagnosis, the treatment, and the prognosis of breast cancer. What you've discovered is that despite the fact that breast cancer is a disease that terrorizes women before they get it and imprisons them forever after they get it, it's really a disease that we routinely catch quite early and routinely cure quite entirely. This means that the vast majority of women who have had breast cancer go on to have normal lives. But wait, menopause itself is something that disrupts the lives of most women regardless of whether or not they've had breast cancer. And the thing many women turn to in order to return their menopausal lives to normal is HRT. So after having all the disruption of breast cancer and moving beyond it, women who have had breast cancer often wonder if they can turn to HRT to return their lives to normal. So this video is going to address the question of whether or not you can take HRT if you've had breast cancer. You definitely need to watch this video. I do not address this in my book. I can present so much more here in these videos than I can in my book. And that's what makes these videos so vital. So let's start with a quiz question. That will get your mental juices flowing. Which of the following is true of your eligibility for HRT use? A, you can take HRT if you have dense breasts. B, you cannot take HRT if you have dense breasts. C, you can take HRT if your mother had breast cancer. D, you cannot take HRT if your mother had breast cancer. E, you can take HRT if both your mother and your sister had breast cancer. F, you cannot take HRT if both your mother and your sister had breast cancer. G, you can take HRT if you have a genetic mutation for breast cancer. H, you cannot take HRT if you have a genetic mutation for breast cancer. I, you can take HRT if you yourself had breast pre-cancer. J, you cannot take HRT if you yourself had breast pre-cancer. K, you can take HRT if you yourself had invasive breast cancer. I, you cannot take HRT if you yourself have had invasive breast cancer. M, A, C, E, G, I, and K above. N, B, D, F, H, J, and L above. O, A, C, E, H, J, and L above. P, A, C, E, G, I, and L above. Easy or tricky? Which was it? Did you struggle with any of the options? If so, what was your dilemma? Where do you draw the line between being eligible for HRT and being ineligible for HRT? Well, here's the quiz question with the answer in bold font. In other words, you can take HRT if you have dense breasts, if your mother had breast cancer, if both your mother and your sister had breast cancer, if you have a genetic mutation for breast cancer, if you yourself have had breast precancer, and even if you yourself have had invasive breast cancer. Okay, I know you're probably freaking out and shouting, horror upon horrors! But try to contain yourself, empty your mind of all the brainwashing you've endured, and listen to this presentation. This video is entitled, Can You Take HRT If You've Had Breast Cancer? And the quiz question options ranged from having a risk factor for breast cancer, to having relatives with breast cancer, to having a gene mutation for breast cancer, to having had breast precancer, to having had invasive breast cancer. And the correct answer indicates that you are eligible to take HRT in all of those scenarios. So why in the world have you heard precisely the opposite about all these things? That's what we'll address in this video. You've already learned that despite all the hype, fear, and avoidance of HRT, there is nothing to confirm that HRT causes breast cancer, and yet many people still blame HRT for causing it. Because of this misplaced blame, there are women who think they cannot take HRT if they have a family history of breast cancer. That has never been true. There are women who think they cannot take HRT if they have a high risk of breast cancer. That has never been true. There are women who think they cannot take HRT if they have a genetic mutation for breast cancer. That has never been true. There are women who think they cannot take HRT if they themselves have had breast precancer and cured it. That has never been true. And there are women who think they cannot take HRT if they themselves have had invasive breast cancer and cured it. And that just depends on the individual situation. So this video will address the facts on your eligibility for HRT if you yourself have had invasive breast cancer. I'm not going to give you separate videos on your eligibility to take HRT if you have a family history, a genetic mutation, or a high risk of breast cancer. In those situations, you can and always could take HRT. The only reason any woman has ever thought otherwise is because of illogical, extrapolated, inflated, and twisted fear-mongering. So let's look at some case scenarios to determine what dictates your eligibility or ineligibility for HRT. One scenario is as follows. You've had invasive breast cancer and you've undergone treatment for it. The treatment was successful and you are clear of all invasive breast cancer. And now you're having miserable symptoms of estrogen deficiency. You're barely able to function and you're thinking, I just can't live like this. An alternative scenario is one in which you've had invasive breast cancer and you've treated it successfully. While your symptoms of estrogen deficiency aren't so horrible, you're at very high risk for heart attack, osteoporosis, and Alzheimer's. Both scenarios are common situations for women who have had invasive breast cancer. Both are instances in which such a woman might consider whether or not to take HRT. And I think the best way to go about assessing your options is to compare typical management options for these breast cancer scenarios with similar scenarios due to other cancers. That way you'll be able to put it all into perspective, which is something that almost everybody is failing to do at present. So let's go through each of the options I gave you in the quiz question and consider each situation. Options A and B were you can take HRT if you have dense breasts and you cannot take HRT if you have dense breasts. You learned in video number 376 that dense breasts are a risk factor for breast cancer. And the reason dense breasts are a risk factor is because they are typical in women who have had lots of menstrual cycles but few or no pregnancies or breastfeeding. But having a risk factor, any risk factor, for any disease is not the same as having the actual disease. So the question is, does a risk factor for breast cancer make you ineligible for HRT? And the underlying question is, does HRT make dense breasts more of a risk factor for breast cancer than if you didn't take HRT? Don't forget that we are talking about hormones that used to be in your body anyway. And don't forget that we are not talking about compounding the effects of two separate risk factors. HRT is not a risk factor for breast cancer. What if we consider this from the standpoint of what makes your breasts dense in the first place? You might recall this chart we created in video number 358 many moons ago. It depicts the hormones that act on your breasts. Here's my prop version of the same thing. This is our model of your breast cycle. Here you see the effects of all the different hormones and hormonal phases on your breasts. Estrogen causes the ductal portion of your breasts to grow. Estrogen causes growth here of the ducts and of the fibrous component of your breasts. The fibrous component is what makes them dense in the first place. Progesterone causes growth and development of the lobules in your breast. That's the glandular part that produces the milk. Prolactin causes milk production. This is pregnancy. We skip that. The gland just grows. Prolactin causes milk production, and oxytocin causes milk release. And at postmenopause, when you lose all these hormones, your breast glands, which were previously stimulated by estrogen or progesterone, shrink. They are no longer functional, so they shrivel up. Another term for shriveling up is atrophy. Atrophy is when a bodily tissue that was stimulated by a hormone dries up or shrinks in the absence of that hormone. Since estrogen and progesterone stimulate the glands in your breasts, those glands are plump and active in the presence of estrogen and progesterone, but they shrivel and become inactive in the absence of estrogen and progesterone. I guess another way to think of atrophy is to liken it to going out of business or closing shop. You saw this same thing happening with the endometrial lining in your uterus in the absence of estrogen. So inactivity causes atrophy. But that does not mean that activity causes cancer. We're talking about breast glands that responded to estrogen and progesterone for about 40 years. It's what they're supposed to do. That's why you had breast tenderness at times during your reproductive life. And yet, when women have breast tenderness with HRT, they think it's cancer. Crazy! But the glands are not the issue with dense breasts. It's the fibrous tissue that is at issue. It was stimulated by estrogen. And HRT involves taking estrogen. So, does the estrogen in HRT stimulate your dense fibrous tissue so much that it makes taking HRT too risky? No, it doesn't. Without HRT, your dense breasts may become less dense, and with HRT, they may remain dense. But you haven't increased the risk of breast cancer imposed by your dense breasts any more than the estrogen produced by your own body did. So the real question about dense breasts is whether or not dense breasts are so risky that they obliterate your ability to take HRT, even though HRT is not a risk factor for breast cancer. And the answer is no. Here's an analogy. If you had Hashimoto's hypothyroidism, which is an autoimmune disease, and you also had some other autoimmune disease, would you be barred from taking thyroid hormone replacement? Would you assume that because you have one autoimmune disease, which increases your risk for a second autoimmune disease, that you could not take hormone replacement for the autoimmune disease that is typically managed by taking hormone replacement? In other words, does having a risk factor for one disease mean that you should not treat another disease? I know of no other situation in which the notion of omitting hormone replacement is employed merely because of a risk factor for the disease that requires hormone replacement. So dense breasts are not a contraindication to taking HRT. So let's move on to the second quiz answer options. Options C and D were as follows. You can take HRT if your mother had breast cancer, and D was you cannot take HRT if your mother had breast cancer. So basically this option says, if someone else had breast cancer, you cannot take the hormone replacement, even though HRT is not a risk factor for breast cancer. In video number 372, you discovered that if your mother had breast cancer, it increases your risk from 1 in 7 to 1 in 4. A 1 in 4 risk of getting breast cancer means that you have a 3 in 4 risk of never getting breast cancer. So you have a 25% risk of getting it and a 75% risk of never getting it. And the question is whether or not those odds are worth forfeiting the benefits of HRT. Once again, I know of no other disease in which your options for treating a hormone deficiency are restricted because someone else had the disease. If your mother had thyroid cancer, would you be barred from taking thyroid hormone for your hypothyroidism? Sounds really goofy, doesn't it? And that's because it is. Quiz question options E and F stated, E, you can take HRT if both your mother and your sister had breast cancer, and F, you cannot take HRT if both your mother and your sister had breast cancer. So now, with both your mother and your sister having had breast cancer, your risk increases from 1 in 7 to 1 in 2. So you have a 50% risk of getting it and a 50% risk of never getting it. And once again, we have to ask whether you should be denied HRT because someone else had the disease. Remember that big, long list of risk factors for breast cancer? What if your mother and sister have a whole lot more of those risk factors than you have? What if their lifestyles are very conducive to breast cancer and yours isn't? What if your mother has a gene mutation that caused her breast cancer, which she passed on to your sister, but not to you. Do you see how acting merely on the fact that your mother and sister had breast cancer can be very, very short-sighted? And notice that only 15 to 20% of breast cancers have family history as a risk factor. So you can still take HRT if both your mother and sister had breast cancer. Next, options G and H were G, you can take HRT if you have a genetic mutation for breast cancer, and H, you cannot take HRT if you have a genetic mutation for breast cancer. Now, instead of just a family history which is not due to a genetic mutation, these options involve an identified genetic mutation. So would that be a reason to forfeit HRT if you wanted it? How would forfeiting it matter if HRT is not even a risk factor for breast cancer? And a genetic mutation is not a destiny to develop breast cancer. It's just a strong predisposition. Plus, there are many options for reducing any risk of breast cancer that is due to a genetic mutation. Are you ineligible for thyroid hormone replacement if you have a genetic mutation for thyroid cancer? No, you are not. Are you ineligible for insulin replacement if you have a genetic mutation for a gastrointestinal cancer? No, you are not. And you are not barred from any other hormone replacement therapies for hormone deficiencies because of any genetic mutation. So not even a genetic mutation bars you from taking HRT. And now we come to a biggie, options I and J. They stated, I, you can take HRT if you yourself have had breast precancer, and J, you cannot take HRT if you yourself have had breast precancer. In video number 362, I presented the breast precancers, and you were probably very surprised to find that the familiar lobular carcinoma in situ, LCIS, and ductal carcinoma in situ, DCIS, are both precancers. They are not actual cancer. This is because, by definition, a cancer has to have invaded the surrounding tissues in order to be a cancer. And neither LCIS nor DCIS has invaded the wall of the very lobule or duct where it originated. This toilet paper roll depicts breast precancer. All the abnormal cells are still inside the roll with no invasion through the wall, regardless of whether the cells are all alike or different. This toilet paper roll depicts invasive breast cancer. The abnormal cells are not confined to just inside the wall of the roll. They have invaded through the wall and are on the outside. LCIS and DCIS are like this. They are analogous to dysplasias of the cervix, and yet they are managed very differently. With cervical dysplasia, you have the abnormal cells frozen, lasered, or excised. And that's it. Nobody ever mentions it again. You can get pregnant, use birth control, take HRT, you name it. It's over. Finito. But for some odd reason, called fear run amok, when you have the very same thing in your breast, not only do women receive treatments for actual invasive breast cancer rather than just precancer, they are denied HRT even long after they've cured the precancer. It is not at all uncommon for women with breast precancer to undergo lumpectomy, mastectomy, radiation therapy, and chemotherapy. The cure rate for LCIS and DCIS precancers is 100%, much like it is for cervical dysplasia. But even after they are fully cured, women with LCIS or DCIS are commonly denied HRT. And they are labeled with the fuchsia B for breast cancer, a label that they carry with them for the rest of their lives. Nobody cares if their quality of life is terrible or if they're very high risk for the diseases of estrogen deficiency. Even though they never even had breast cancer, they are marked and marginalized for life. This makes no sense. It is all driven by irrational fear. So yes, you can still take HRT even if you've had breast precancer. And the final options, K and L, read, K, you can take HRT if you yourself have had invasive breast cancer. And L, you cannot take HRT if you yourself have had invasive breast cancer. So this is a situation in which you did have actual invasive breast cancer, but you received treatment for it in any of a variety of forms, and it's gone. So why shouldn't you be able to take HRT if you so desire? This is another situation in which even after treating and curing the disease, women are viewed as if they still have the disease for the rest of their lives. In the units on endometrial uterine cancer and cervical cancer, you learn that if you treat those cancers, you are free to do as you please for your menopause management. You can use HRT or anything else you want. That's the standard of care. And that's because you cured the cancer. It does not define you any longer. But the same is not true for breast cancer. For breast cancer, it is standard of care to deny everything. It is standard of care for your doctor to dismiss all your other concerns regarding quality of life and prevention of diseases due to estrogen deficiency. It is standard of care to treat former breast cancer patients as if they still have breast cancer for the rest of their lives. It's as if you can't shake it no matter what you do. Even though you can succeed in treating it and being completely cancer-free, most women live in the shadow of breast cancer forever. So you can still take HRT even if you've had invasive breast cancer, depending on the specifics of your particular breast cancer. So the answer to the question, can you take HRT if you've had invasive breast cancer, is yes, you can. It's all a matter of your comfort zone, which I'll address shortly. So you may wonder if HRT increases recurrent breast cancer in women who have already had breast cancer. There are multiple studies on this. And in fact, all but one shows that HRT does not increase recurrence of breast cancer at all. Some even showed a decrease in the death rates for women who took HRT after having had breast cancer compared to those who did not take HRT. The only study that showed an increased risk of breast cancer recurrence with HRT was the HABITS study. HABITS is the acronym for hormonal replacement therapy after breast cancer. Is it safe? It contradicted all the other studies on the topic, but made front page news. The HABITS study received heavy criticism for terminating early and then reaching a conclusion that was completely without merit. The HABITS study refuted 20 other studies published between 1980 and 2008. And it only found an increase in recurrent breast cancers among women who were also taking tamoxifen. So again, we have the sensationalism of one renegade study upsetting the apple cart. Another thing that most people fail to acknowledge is that there are a lot of different kinds of breast cancer. People talk about breast cancer as if it's just one disease. It isn't. It is many different diseases, and each one depends on the kind of cell that transformed into a cancer cell, which determines the personality of the cancer. Some kinds of breast cancer may be influenced in some way by estrogen, progestogen, or both. Others may not. And believe it or not, there are some types of breast cancer that are treated with estrogen, progestogen, or both. This is analogous to the fact that there is really only one kind of endometrial uterine cancer that is caused by estrogen. The others have nothing at all to do with it. So be very careful with generalizations. They can make you assume very incorrect things and induce you to react in very distorted ways. Everything in medicine, menopause, and breast cancer is a matter of weighing benefits against risks for any management options. And sometimes the benefits of one are the risks of another. For instance, one of the benefits of drinking 1 glass of red wine daily is that it decreases your risk of a heart attack. But that same 1 glass of red wine daily increases your risk for breast cancer. And the benefits and risk are not the same from woman to woman or from breast cancer to breast cancer. So no matter what someone else is doing or not doing, you absolutely have to do what's right for you personally. You have to know thyself and do what falls within your comfort zone. You know, there's a quote that I love that goes, everything you really want is just outside your comfort zone. And this is as true of deciding whether or not to take HRT after having breast cancer as it is for anything else in life. But with something like considering HRT for menopause management after having had breast cancer, you might be better off staying within your comfort zone. Of course, you'd probably love to be able to use HRT with nary a care about the relationship to breast cancer. And even though all the facts and research suggest that you should be able to do just that, there are all sorts of other things scaring you into thinking just the opposite. And fear is notorious for shrinking comfort zones. Your normal comfort zone may look like this, but fear can shrink it to this. Happens all the time. In any case, consider everything that matters to you in determining your comfort zone. You may feel comfortable taking HRT because of how miserable you feel without it. Your symptoms may be so devastating that they are ruining your quality of life. Or you may be worried about having a heart attack, getting osteoporosis and fracturing your spine or hip, or getting Alzheimer's disease. If so, you may want to take HRT. I always say, begin with the end in mind. In other words, get this education, decide what you want, and then go get it. Do not ask others what you should do. Nobody else is going to live your low quality of life or suffer your heart attack, bone fracture, or Alzheimer's. So you have to be your own advocate and do what's right for you. First, learn all the facts. Second, apply all the facts to your personal situation. Third, weigh the benefits of your management options against the risks of your management options. And fourth, choose management options that fall within your comfort zone. And you have to add to that the fact that there are many different comfort zones. The ultimate decision as to whether or not you should take HRT will extend beyond just your own comfort zone. And this is because you will have a whole team of doctors from different disciplines giving you their advice. Most oncologists say no, 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 because all they see all day is cancers and they know very little about HRT. Most breast surgeons either don't know, don't have a preference, or don't want to weigh in. But they too know very little about HRT and menopause. All they know about is surgery, so they see only a tiny sliver of the world of breast cancer. Most gynecologists say, no way, because they don't want the legal risks. And the comfort zones don't stop there. Your fate may include the comfort zones of the medical facility that treated your breast cancer, the guidelines governing the standard of care, and your insurance company or National Health Service. Some of these breast cancer facilities have become monstrosities and the largest departments in the entire hospital system. So the comfort zone is really many different comfort zones. All told, the comfort zone of the treating facility as a whole is likely to be smaller than yours. Next comes the comfort zone imposed by the prevailing guidelines of the times. That's an even smaller comfort zone. The guidelines may prohibit HRT after having breast cancer. But remember, guidelines are always about the entire population. They are never about you personally. And they are always, always, always based on money. No guideline cares a fig about what happens to you. After that, you have to take into account the comfort zone of your insurance company or National Health Service, or the payer. That's likely to be even smaller, a lot smaller. Your insurance company may refuse to pay for HRT after breast cancer. Your National Health Service may refuse to provide HRT after breast cancer. Of course, the insurance company and National Health Service know absolutely nothing about HRT or breast cancer. They're just doing things in accordance with the prevailing standard of care for payment for the entire population. They're just in the business of finding ways to avoid spending money on you. If that's the case, you may want to change insurance companies, or you may want to pay for HRT yourself. Then you have to consider the comfort zone of your doctor. This one is likely to be the smallest of all. Your doctor may be uncomfortable prescribing HRT for you based on any number of factors, including lack of knowledge, fear of litigation, conformity with the status quo, or the erroneous belief that HRT causes breast cancer. If that's the case, and you still want to use HRT, you're going to need to find another doctor. So take responsibility. Offer to sign a consent form or a disclaimer or a waiver of liability. There is no right or wrong when it comes to taking HRT after having had breast cancer. There are just different comfort zones. So you can see that there are many different comfort zones at play when it comes to the question of taking HRT after having had breast cancer. The key is to know that there is no rule, no specific rule. You can do whatever you want. You just have to understand why the state of affairs is so out of whack, unlike it is for any other cancer. And you have to be prepared to be proactive and fight for what you want. It is not easy to find a doctor who will give you HRT after you've had breast cancer, but they do exist. And when you stop and think about it, women with breast cancer are not the only ones who are having difficulty. It is happening to women who are perfect candidates for HRT too. The current state of affairs for postmenopausal women in general is dismal. It shouldn't be that way, but it is. And you need to know it's dismal, and you need to know why it's dismal. It's because of the anti-HRT sentiment in general and the anti-HRT sentiment after breast cancer in particular. And it's all due to fear, not logic. If you have my slide chart, you will notice that answering yes to the question, are you at risk for breast cancer, leaves all your hormonal options blank. This is not because they are prohibited. It's because that's what you will discover to be the general consensus and dismal standard of care. But the general consensus happens to be generally senseless. In creating the slide chart, I struggled with this. And in order to avoid complete confusion, I opted to leave the hormonal options blank. This is not because you cannot take HRT. Notice that the slide chart question asks if you are at risk for breast cancer. It does not ask if you have had breast cancer. And today, you've learned that you can take HRT even if you have had breast cancer. But every situation and every comfort zone is different, and I did not want to send a message through the slide chart about your eligibility for HRT without this educational backing. The slide chart is a shortcut. It does not provide you with an education or the whole story. Now you know the whole story, so now you can decide for yourself whether or not HRT is right for you. So the summary is that there is no situation in which a risk factor, a genetic mutation, or a history of breast cancer makes you ineligible for HRT if you want to use it. But unlike any other cancer, the distortions in the world of breast cancer make it difficult for you to exercise your options. Can you believe how many layers of weirdness there are in the world of breast cancer? Knowing the truth about the state of affairs gives you power to weigh your options fairly. What's unfair is people scaring you, telling you you had cancer when you didn't, over-treating you for a cancer you didn't have, and then making you live your life in a way that bars you from having access to managing your menopause as you please and being marked for life as somewhat of an outcast. Breast cancer and your menopause management are not ethical, moral, or legal matters. They are personal, logistical, quality of life, and comfort zone matters. And I will continue making sure you know all the facts so that you can make decisions based on fact rather than fear. So I'll stop now before I blow my stack. If you want to read more about your eligibility for HRT after having breast cancer, these are two excellent books. I've shown them to you before. This is Estrogen Matters by Avram Blooming, MD, and Carol Tavris, PhD. And this is Assess Your True Risk of Breast Cancer by Patricia T. Kelly, PhD. I think that you'll find them very helpful. You know that you can go to menopausetailor.me to schedule a consultation anytime. And you can go to Facebook, Twitter, Pinterest stories, and Instagram to see me anytime. And you can stay right here to subscribe to my newsletter and to my channel anytime. And I will see you in a week to talk about prostate cancer compared to breast cancer, of all things. Bye!